Hello, my name is Beverly Vanover, and I'm going to spend the next 20 to 25 slides presenting this training called How to Start Delivering Mental Health Counseling and Therapy Services Online. Many of you may be interested in providing counseling online and wondering what it takes to successfully create a full-time online practice. It has always been my goal to provide online counseling, and I am fulfilling my dream of working from home doing just that. My experience related to being able to deliver this training begins with the fact that I am licensed to practice counseling. I have obtained the National Certified Counselor recognition from the National Board of Certified Counselors and a Distance Credentialed Counselor recognition from the Center for Credentialing and Education Incorporated. I have obtained training towards the specialization of technology-assisted counseling required by the state of Arkansas, and I received that training from Michael Jones with Renewed Vision Training. I've been practicing counseling since 2013 and am licensed in the states of Missouri, Texas, and Arkansas as a licensed professional counselor. My experience in the field of mental health includes working as a community-based therapist, school-based therapist, hospital-based therapist, and therapeutic day treatment therapist. I have experience facilitating mental health and 12-step program groups for the community as well as in the institutional setting. I have treated children and adults and most recently completed requirements as a certified clinical trauma professional. I have a full-time and solely online private practice called Dragonfly Counseling and Coaching, and I'm currently contracted with BetterHelp.com, Teladoc.com, and MGLive.com to provide online counseling. My current caseload consists of only adults who live in Missouri, Texas, and Arkansas. I currently reside in Arkansas. As I go through the presentation, I will be sharing my own procedures I use every day as I deliver online counseling. I want to thank my colleague Kay Adkins, LPC, for designing the content of the following presentation slides. Let's get started. You might appreciate knowing a little history behind the decision to develop this training. With continuing growth in the telehealth industry, it is clear that many people are interested in doing online counseling as an addition to their brick and mortar practice, and many are interested in doing it full time. All of us are concerned, or we ought to be, about practicing online ethically, and our clients' care is always at the forefront of our concerns. So, hopefully sharing with you what it takes to build and maintain a full-time online practice with what I like to call a turnkey platform will be helpful. Turnkey to me represents a platform from which a counselor may receive referrals and be able to facilitate creating a schedule within that platform for delivering counseling using technology of video, telephone calls, email, and chat features built into that platform. So, as a result of this training, you will be maybe re-familiarized with and better able to interpret ethical guidelines about telemental health training, regulations, and policies. It is my hope you will be better able to formulate decisions about constructing and building your own personal practice of telemental health therapy or counseling that will include learning some strategies for doing this within any turnkey type platform. So, there are several sections to this training. Section 1 will start with what will meet requirements for ethical considerations, guided by a look at the perspectives of governing bodies or entities such as the American Counseling Association, American Psychological Association, National Association of Social Workers, the National Board of Certified Counselors, as well as a few states that, as of this training, have specific laws, statutes, rules, and regulations pertaining to the delivery of online counseling. Section 2 will then move into recommended training, development and liability issues that are becoming standardized within the counseling industry regarding delivery of online counseling. A few groups that offer training to be able to perform online counseling are discussed. Education standards for providing online counseling have been addressed by the major governing bodies. Malpractice insurance will provide an opinion and guidance regarding the expectations of training and development, and some examples will be given. In Section 3, skills and processes will be discussed as essential to delivering online counseling, as many are unique to doing therapy online as opposed to doing it in person, not only in regards to extra technology used, but also considering the skills needed for managing a private practice as the sole operator who handles all the everyday activities involved. Section 4 will discuss several platform options considered to be turnkey in nature, with most providing all the components needed to perform online counseling. Section 5 looks at the flow of a typical practice that takes an ethical and practical approach from intake, communication, and developing rapport to maintaining the caseload and terminating counseling. Section 6 will offer documentation examples that will be downloadable from this training. Section 7 will wrap up training with a summary of what was learned and outlined at the onset of this training as objectives. If you're taking this training, you are likely a licensed professional, at least with a master's degree, and even at the doctoral level of your education. By now, you've become aware of who your governing entities are regarding your provision of counseling. Who is the governing body and/or entities is something you're familiar with. What you may or may not be familiar with at this stage are the written statements by these entities regarding the delivery and provision of telemental health, which may be called online counseling, e-counseling, or technology-assisted counseling. This service is delivered by means of both asynchronous and synchronous technology using email, chat, video, and telephone, and is growing to be used in conjunction with and in replacement of traditional office visits for some providers and their clients. According to Metonia.org, the earliest delivery of online psychological services was provided free to students on campus at Cornell University beginning about 1986 and was called Ask Uncle Ezra. It was 10 plus years after the internet was literally invented, and it was tested by doing a mock psychotherapy session during the International Conference on Computer Communication in 1972. The American Counseling Association, headquartered in Alexandria, Virginia, was established in 1952. And that can be found at www.counseling.org. The American Psychological Association, headquartered in Washington, D.C., was founded in 1892, and that web address is www.apa.org. The National Association of Social Workers, headquartered in Washington, D.C., was established in 1955. That website is www.socialworkers.org. The National Board of Certified Counselors, headquartered in Greensboro, North Carolina, was established in 1982. That website is www.nbcc.org. Your state will have a board responsible for governing and providing licensure information relevant to your practice, as you know. Interestingly, there is an American Association of State Counseling Boards established in 1986 and headquartered in Broken Arrow, Oklahoma. In addition, each state will likely have written codes, statutes, rules, and regulations that you're either familiar with or would want to be. As of this training, a very helpful website is found at www.ebglaw.com. And Epstein, Becker, and Green, a Washington, D.C. based law firm, continuously conducts surveys of state telehealth laws, regulations, and policies within mental health, and now in its fourth year provides an app for iPhone, iPad, and Android devices called Telemental Health Laws. As stated in the American Counseling Association Code of Ethics, counseling is no longer limited to in-person, face-to-face interactions. The nature of online delivery of counseling continues to evolve, and licensed professional counselors are actively trying to understand the knowledge being created and take into consideration the legal competencies they will need as the practice continues to evolve. Similarly to in-person counseling, informed consent, a thorough assessment and complete disclosure of credentials, risks and benefits, possible technology failure plans, response times, emergency procedures, time zones, cultural or language differences, insurance benefits, and social media policies are important to consider and inform clients about. Client verification is a unique issue when considering a counselor may never meet the client in person and is ultimately the counselor's responsibility to ensure. Counselor's virtual presence on social media needs to be separate from personal virtual presence, and counselors respect the privacy of clients' virtual presence unless given consent, and all precautions are taken to avoid sharing confidential information over social media. American Counseling Association suggests writing a social media policy, identifying social media use in the informed consent, even if it is something like, I do not maintain social media or interact with clients on social media. Section H of the ACA Code of Ethics addresses the use of technology to deliver services, and the entire PDF can be located at www.counseling.org. Counselors ensure that their clients are aware of pertinent legal rights and limitations governing the practice of counseling across state lines or international boundaries. Counselors make reasonable efforts to determine that clients are intellectually, emotionally, physically, linguistically, and functionally capable of using the application, and that the application is appropriate for the needs of the client. ACA is the world's largest organization for counseling. The American Psychological Association, recognizing the need to provide guidelines for online counseling to psychologists, created the Telepsychology Task Force, who identified two important components as aspects that telecommunication technologies bring to the practice of psychology. They are the psychologist's own knowledge of and competence in the provision of telepsychology, and the need to ensure that the client or patient has a full understanding of the potentially increased risks to loss of security and confidentiality when using technologies. The 8 guidelines are intended to provide the best provision of psychological services while using telecommunication technologies, focusing in the areas of competence, standards of care, informed consent, confidentiality, security and transmission and disposal of data, information and technologies, provision of testing and assessment, and interjurisdictional practicing. APA states that the process of explaining and obtaining informed consent by whatever means obtained sets the stage for the relationship between the psychologist and the client patient. And psychologists will consider appropriate policies and procedures to address the potential threats to the security of client-patient data and information when using specific telecommunication technologies, and appropriately inform their patients about them. APA states that these guidelines are designed to address the developing area of psychological service provision commonly known as telepsychology. Telepsychology is defined, and for the purpose of these guidelines, as the provision of psychological services using telecommunication technologies as expounded in the definition of telepsychology. The expanding role of technology in the provision of psychological services and the continuous development of new technologies that may be useful in the practice of psychology present unique opportunities, considerations, and challenges to practice. With the advancement of technology and the increased number of psychologists using technology in their practices, these guidelines have been prepared to educate and guide them. These guidelines are informed by relevant American Psychological Association standards and guidelines, including APA Ethics Code dated 2010 and the APA Record Keeping Guidelines of 2007. In addition, the assumptions and principles of multicultural training, research, practice, and organizational changes for psychologists are infused throughout the rationale and application describing each of the guidelines. Therefore, these guidelines are informed by professional theories, evidence-based practices, and definitions in effort to offer the best guidance in the practice of telepsychology. APA is the oldest organization for psychological counseling, noting 125 years at the time of this training. APA is the leading scientific and professional organization representing psychology in the United States. The guidelines for the practice of telepsychology can be found at www.apa.org. The National Association of Social Workers and the Association of Social Work Boards have written 10 standards for technology and social work practice. The organizations have recognized that technology has created the requirement for a special set of skills and knowledge to provide the best available as an adjunct to a brick and mortar practice or exclusively conducted with technology. NASW states that these standards provide guidance for the goals to maintain and improve the quality of technology-related services provided by social workers, to serve as a guide to social workers incorporating technology into their services, to help social workers monitor and evaluate the ways technology is used in their services, to inform clients, government regulatory bodies, insurance carriers, and others about the professional standards for use of technology in the provision of social work services. NASW defines technology as any electronic mediated activity used in the conduct of competence and ethical delivery of social work services. The standards involve the following. Social workers provide services via the telephone or other electronic means, shall act ethically, ensure professional competence, protect clients, and uphold the values of the profession. Social workers shall have access to technology and appropriate support systems to ensure competent practice and shall take action to ensure the client has access to technology. Social workers shall select and develop appropriate online methods, skills, and techniques that are attuned to their clients' cultural, bicultural, or marginalized experiences in their environments. In striving for cultural competence, social workers shall have the skills to work with a wide range of people who are culturally different or who may be considered a member of a vulnerable population, such as people with disabilities, racial, ethnic, and sexual minority status, and those whose primary language may not be English. Social workers shall be responsible for becoming proficient in the technological skills and tools required for competent and ethical practice and for seeking appropriate training and consultation to stay current with emerging technologies. Social workers who use telephonic or other electronic means to provide services shall abide by all regulations of their professional practice with the understanding that their practice may be subject to regulation in both the jurisdiction in which the client receives services as well as the jurisdiction in which the social worker provides services. Social workers who use electronic means to provide services shall represent themselves to the public with accuracy to make efforts to verify client identity and contact information. Social workers shall protect client privacy when using technology in their practice and document all services, taking special safeguards to protect client information in the electronic record. Social workers providing services through the use of the telephone or other electronic means shall ensure high-quality practices and procedures that are legally sound and ethical to protect clients and safeguard against litigation. Social workers shall use practice competencies of advocacy and social action, community practice, administrative practice, clinical competencies, research, and supervision. Social workers shall adhere to the NASW standards for continuing professional education and follow applicable licensing laws regarding continuing education delivered via electronic means. The National Association of Social Workers, NASW, is the largest membership organization of professional social workers in the world. These standards can be found at www.aswb.org. The National Board for Certified Counselors defined the first of such standards in the mental health profession in 1997 when it defined cyber counseling or web counseling as the practice of professional counseling and information delivery that occurs when client and counselor are in separate or remote locations and utilize electronic means to communicate over the internet. At that time, the considerations were related to truth in advertising, confidentiality and privileged communication, duty to warn, competence, dual relationships, psychoeducation, pre-screening, cultural competencies, counselor anonymity, fee structure, and delivering advice versus counseling. NBCC states that the most recent review of the practice of Internet counseling supports a revision in standards as of 2016. And the following fundamental concepts have been identified. Number one, counseling through distance means presents unique ethical dilemmas to professional counselors. Two, related technology continues to advance and be used more by increasing numbers of professional counselors. 3. Use of technology of counselors continues to evolve. Key terms within this set of standards involve face-to-face, distance professional services, counseling, supervision, and consultation. Common synchronous methods for the provision of these key terms are telephone-based, chat-based, and video-based methods. Common asynchronous methods include email and social network. Social network can also be synchronous. There are 20 standards for distance professional services. NBCC is the highest standard for nationally certified counselors, and many state boards consider NBCC as a technology-assisted specialization standard governing body. Nationally certified counselors shall develop written procedures for verifying the identity of the recipient, his or her current location, and readiness to proceed at the beginning of each contact. Also, NCC shall advise clients about the potential risks of sending messages through digital technology and social media sources. Each state constructs legislation regarding counseling and has created boards that write rules and regulations. Not every state has an opinion about online counseling as of yet, and it is likely that more and more states will start incorporating written opinions, rules, and regulations regarding online counseling. It is at the state level where consideration is apparent as to where counseling is taking place for jurisdiction purposes. It's common to expect that you'll be required to be licensed in both the state that you are located as well as the state where the client is located. I've recently seen some information about the idea that if one has a specialization on their license, then other states may let a counselor see a person located in their state because of the specialization and in lieu of being licensed in that state. However, there could be exceptions spelled out. This trend is likely to increase as more counselors work online, and hopefully the case for licensure portability will grow into discussions of national licensure. Very likely that type of national licensure will require training and certification to provide telemental health. Wouldn't that be great? Here are a few statements from states who've written rules and regulations at the time of this training. In Texas, a licensee shall not render therapy using technology-assisted services without complying with the following at the onset of each session. Number 1, fully verifying the location and identity of the client to the most reasonable extent possible. Number 2, disclosing the identity and applicable credentials of the licensee. And 3, obtaining appropriate consents from clients. That information can be found at a website called telementalhealthtraining.com/Texas. In North Carolina, for instance, the board considers that the practice of counseling occurs both where the counselor who is providing counseling services is located and where the individuals or clients who are receiving services are located. On this basis, if an individual licensed in North Carolina renders services electronically to an out-of-state client, it is the responsibility of the counselor to ensure that the counselor is complying with the laws and rules in the other state. That information can be found at the same site, telementalhealthtraining.com/142-North-Carolina. In Arkansas, any technology-assisted distance counseling or marriage and family therapy that occurs within the state of Arkansas, whether by an Arkansas counselor or by an out-of-state counselor or marriage and family therapist, is deemed to have occurred in Arkansas. All providers of services, whether traditional or technology-assisted, who may offer or provide counseling or marriage and family therapy services to individuals or groups, must hold a valid Arkansas license to provide such services. That's found in section 3.6(7)(f) of the Arkansas Board of Examiners Rules and Regulations. Georgia, for instance, out-of-state clients. Licensees who want to offer telemental health services outside the state are advised to check with the state board in which the client resides for information about telemental health regulations outside of Georgia. This is directly from section B247 from the Rules and Regulations of the Georgia Composite Board of Professional Counselors, Social Workers, and Marriage and Family Therapists. And lastly, last state example is Mississippi. Practice of distance professional services states that any person that provides counseling or supervision services through the means of distance professional services must hold a license in good standing in both the location where services are provided by the professional as well as in the location of the recipient of the services, and must also hold the distance credentialed counselor credential or its equivalent as recognized by the Center for Credentialing and Education Incorporated or the National Board of Certified Counselors. Distance professional services must be performed in accordance with these rules and regulations. The current American Counseling Association's Code of Ethics, the current National Board for Certified Counselors of policy regarding the provision of distance professional services, and Mississippi and federal law. This can be found at the Mississippi Regulation page 42, Rule 7.5. As of this training, again, I mentioned earlier at the beginning, a very helpful website is found at www.ebglaw.com. And Epstein, Becker and Green, which is a Washington-based law firm, continuously conduct surveys of state telehealth laws, regulations, and policies within mental health. And now in its fourth year, provides an app for iPhone, iPad, and Android devices called Telemental Health Laws. I found this very helpful when I'm working with a client who is moving, going to be in another state, and we haven't quite finished our episode of care. This app allows me to very quickly read some of the pertinent information about telemental health laws, relationship to the client, opinions on where counseling is occurring, etc., and gives a quick access to the website for that state's board. And then I have been successful in contacting other boards and letting them know the situation, and that would be wrapping up counseling, or the client would be temporarily located in their state, and then I've gained written permission to go ahead and see that client, which has been really helpful. Here just are a few names of groups who offer telemental health training. I imagine we can expect a list like this to grow quite a bit as the trend and desire for doing online therapy increases both for the client population and the counselor population. Many of these courses address several methods for delivering counseling, educating about legal standards of the governing entities at the national level, discuss technology needs and best practices as well. Some provide newsletters, free continuing education opportunities, and informative links to articles about the profession of online counseling, customizable policies and procedures, and consulting services. Security and HIPAA compliance is an important aspect of these trainings, as well as knowledge about orienting clients to online environments and presentation skills via video. It will be a common trend that these training entities will seek approval from the NBCC to provide continuing education units. Many trainings like these will be approved for further certification through the national level, as outlined in the Center for Credentialing and Education website. While doing a recent search to look at trends for training in telemental health services, I located another helpful site at www.telehealth.org, which seems to provide approved trainings in the industries. Training to be able to perform online counseling is a requirement in part because it's considered to be a competence-based modality and maybe meets some definitions of a particular modality. And any modality we use with clients, we must have training in order to use according to our governing entities. American Counseling Association says that counselors who engage in the use of distance counseling, technology, and/or social media develop knowledge and skills regarding related technical, ethical, and legal considerations. An example given, special certifications and additional coursework. APA states psychologists have a primary ethical obligation to provide professional services only within the boundaries of their competence based on their education, training, and supervised experience, their consultation, study, or professional experience. NBCC states that NCCs shall provide only those services for which they are qualified by education and experience. NCCs shall also consider their qualifications to offer such service via distance means. National Association for Social Workers state that social workers should acquire adequate skills that use technology appropriately and will adapt traditional practice protocols to ensure competent and ethical practice. Malpractice insurance will have an opinion on training also for telemental health, and understandably due to liability issues. There's a similar language in each of the samples given next. Zur Institute has gathered information that supports the basics. Insurance companies will cover telemental health, e-therapy, or online therapy if the insured practices legally within the scope of his or her profession and within the scope of his or her expertise. It's advised that you call your insurance company to verify your coverage for online telemental health services. The trust generally covers licensed psychologists. Jerry Kuchar, PhD, a trustee for the trust, posted the following on January 15th of 2013. The professional liability policy provided by the trust is a broad-based policy that would cover any policyholder for civil liability or board complaints arising out of provision of telepsychology services. In the same way, it provides coverages for other claims and complaints. No provider of professional liability coverage, however, will cover claims of criminal liability. American Professional Agency covers psychologists and other mental health professionals. And in response to an inquiry regarding their coverage of telemedicine and telemental health in January of 2013, a representative of the agency received the following response. Please be advised that while this activity would be covered under the policy, there are some factors you should take into consideration. First, if you do not hold a license in the state where your patient resides and one is required, you may not be covered by the policy. Second, you must be HIPAA compliant, which includes, but is not limited to, using a secure site to avoid any breach of a patient's rights. Being non-compliant could put you at risk to fines and penalties, as well as having a suit or complaint being brought against you for breach of confidentiality. NASW Assurance Services, which covers social workers, posted an important caution for social workers practicing online therapy, which includes these statements. The social work professional liability insurance policy sponsored by NASW Assurance Services provides coverage worldwide as long as the claim is made and the suit is brought in the United States, its territories, possessions, Puerto Rico, or Canada. Therefore, it's not necessary to purchase another policy for internet phone telecommunication practice. There may be different requirements and/or licensure in the various states in which you may be practicing. As stated in number 6, exclusions under item Q of the insurance policy, coverage would be excluded for a wrongful act committed while you do not have a license as required by law. You must be practicing legally for the policy to afford coverage. CPH covers California marriage and family therapists and other mental health professionals. CPH states on its website regarding coverage for e-therapy or internet therapy, yes, provided such practice is authorized or allowable under the scope of your license in the state where you practice and provided you're performing such services lawfully. Contact your state licensing board if you're unsure. Now, I want to go over what I've discovered through starting from scratch and building a full-time online practice from home, and with having attained my training and then certification for distance counseling in regards to some basic and necessary skills for delivering counseling online. What has transpired over the last 2 years has led me to be able to share with others that what I've learned is working in terms of building and maintaining a practice that works for me. I have identified what I'm calling necessary skills and processes. Let's talk about some things we may not think about in terms of camera use. For instance, at the time of this recording of this training, I'm using an internal camera and microphone, although I know you're not seeing my image. I could have done that. And a Lenovo desktop computer, which I purchased from Best Buy. I prefer the desktop setup I currently use. I've successfully used an external camera mounted on a laptop with external earphones as needed as well. Did that for probably a year and a half. It seems that high density 1080 pixels HD 1080p is producing a quality image when I'm seeing my clients over video. It's important to consider what your image looks like to your client. So you'll want to ask a few clients how your image is coming across, or you could test it somehow with someone who can give you that feedback. It's important to look at the lighting in your office space, and it's been advised that putting a light or a lamp behind the camera where it is shining a light on your face, like on a desk sitting behind your computer somehow, will offer the client a better image of you, a clearer, brighter image of your face. Pay attention to what your clients will see behind you as well. Meet in the same place so that consistency is what your client feels when they meet with you. It's tempting to meet anywhere, and some clients will do this. I suggest creating a dedicated office space for your online counseling business with care taken to create a warm, inviting environment, just like you would in a brick and mortar practice. When you're in session, make regular eye contact with the actual camera lens. This will give your client the sensation of you making eye contact with them. This can be distracting to you at first because you'll want to look at your client, and of course do need to glance at the client's image so you can assess nonverbal cues. And you may be wanting to type notes concurrently with the session, so your eyes will be moving away from the camera. Just realize when you're not looking at the camera, your client will not have the confirmation that you're looking directly at them. It's possible they may not feel listened to if you don't give regular eye contact, so just be aware of this phenomenon. It's unique to providing video counseling. Most importantly, simply communicating this phenomenon to the client can alleviate any discomfort for both. I usually have this communication as part of my initial informed consent routine, or certainly in a first session. And letting clients know too that when doing counseling using technology, you're going to experience technical difficulties. It's a given. It's not a matter of if it will happen, but more like when it happens. So discussing this ahead of time is important in order to share a plan for reconnecting. In the platform I use, I can send a telephone link if my client and I lose a video link or cannot connect via video for some reason. It's a private telephone link. This plan aligns with our ethical considerations to help the client navigate technology, and we do have a duty to help train them as much as possible and refer them to tech assistance when the issues reach a level we as the counselor no longer can predict or instruct on or fix for them. It's important to provide reassurance though during these technical difficulties and have a plan that you share with your client that provides alternative methods of connecting to you synchronously, privately, in example, phone or chat, and also secondarily, asynchronous ways of contacting, such as, encrypted or HIPAA-compliant email or text messaging. I mentioned good eye contact before in regards to using cameras. This is a component of building good rapport, which we're all familiar with in terms of therapeutic efficacy. Good eye contact, good tracking, facial expressions, body language, etc. You will find you're able to do your thing, in other words, do what you do best in terms of connecting therapeutically with your client using technology, and you'll adjust and learn along the way with exercising some planning and patience. As we always do a lot of writing as counselors, so writing skills being necessary sounds sort of obvious. However, in a platform of online counseling, when we're typing back and forth with our clients, it's easy to get into a text-based format and possibly lose some professional writing skills in the process. I start every communication I have with my clients when it's written with an appropriate salutation and end with common farewells. Dear client, and I hope to hear from you soon in closing. I'll use their first name and say hello, and I'll sign my name at the end after saying I look forward to your response. Just like in-person therapy, I use open-ended questioning and include a question in every email or text type response I give to client. If you Google writing prompts, you may find suggestions for narrative and personal writing. I found one PDF that had 650 prompting type of questions. They almost all start with good interviewing questions that start with who, what, where, when, why, and how. And variations of these types of fact-gaining questions start with do you, is your, are you, can you, has anyone, if you, etc. Building good rapport using technology is similar to doing it in person. Some nonverbals are difficult to see or pick up on when using technology, and I think it's important to pay attention to some skills unique to building rapport on video or the telephone and also in writing to our clients. We've discussed giving good eye contact on video. In addition to that, speaking more clearly and checking in with the client to make sure they're hearing you well is something important to do. And frequently if you suspect they're not hearing you. We ought not to assume we're being heard and understood when using technology to communicate. I've noticed a lag time also in video before, which is probably due to an internet connection issue. So you'll encounter times when it may be better to switch to telephone and when you and your client are not understanding each other clearly. This is part of reassuring your client and building rapport while using technology rather than in-person techniques. I feel confident that I'm able to do things like reflective listening, mirroring, providing good eye contact, and unconditional positive regard when I take into consideration the innate characteristics of using technology that could get in the way, and when I provide a plan for getting back on track and always be willing to reassure the client. Understandably, conversations using technology can suffer from audio or video disturbances, can take extra time to set up and learn, to utilize, but with thoughtful planning, discussion, and patience, the learning curve is small. Most clients and counselors who try this online are doing it for reasons that are important to them. So getting past these nuances of in-person versus online therapy happens pretty seamlessly overall in my experience. Administrative skills are essential when in private practice, in brick and mortar settings, and even when working for an organization. We all draw on our skill sets of communication, organization, time management, dependability, reliability, confidentiality, and customer service orientation. These skill sets are at various levels for us as individuals. In private practice, if we're the sole proprietor, we're handling all the requirements of running our practice, and if we cannot manage a particular skill well, then we may be able to hire others to do these things for us. Maybe we can hire others, maybe we can't or don't want to. This is a preference that will be unique to everyone. I've talked about communication and writing and tied it in with good interviewing skills already, so we'll go into some aspects of organization and time management next. I organize my workdays by starting out with sending reminders for my next day's sessions. This will prompt more communication with clients who want to reschedule or cancel, and I take care of those in a timely manner. Then I prepare to be online at the time of my first appointment for the day. When starting the session, I'll send a message to the client that I've arrived for the appointment if I'm able within the platform to do that. In my case, I'm working in a couple of platforms that have a virtual room for the client. Depending on the platform, we may be able to see that each other are online and waiting in queue. If I'm able to, I say hello and let them know I'm ready to begin and how we will be connecting, synchronously, video, phone, or chat. On one platform I work in, it creates a to-do list for me that reminds me that I have a message I have not read. For example, maybe it's been 2 days since the last message, that an appointment has been scheduled or canceled by the client, and allows me to push out reminders as I see fit to manage the calendar. Any subscription or payment questions, I'm able to refer to the platform customer service email. I will collect payments on another platform for which I do the marketing and referring to. On these types of platforms, you'll gain clients who become inactive, just like in a brick and mortar setting. The administrative skills and procedures you'd use can be modified in this online platform. The radio silent client can be managed by pushing out the to-do date as needed or preferred, and I can send unique or even pre-written and copy and paste check-in messages that invite them to connect. I may also start suggesting how they could manage their subscription by either changing counselors or canceling, aligning with typical inactive client protocol. I use my judgment and always invite them to let me know how I can help them. I'll go into more about how I educate my clients about HIPAA and platform protection of their virtual room and the contents. I use the word platforms a few times now to describe the turnkey feature of being able to receive referrals and use synchronous and asynchronous ways of communicating in a HIPAA compliant and virtually encrypted environment. In other words, these are websites you would have a membership with, where you would have a bio page and be sent referrals of clients to work with in ways that you and the client can communicate live with video, phone, or chat, or not live with email and text options. All these possibilities can and will occur via using the website, and clients will sign up and create accounts of their own and use whatever method to communicate to the platform their individual needs by supplying an assessment document, signing and agreeing to an informed consent, and being matched with a counselor. Payment to the counselor is either directly from the client or contracted with the counselor via the referring website. The counselor accepts the referral and begins their own intake process as governed by ethics of their licensing. As of this training, many counselors are going to be contracted 1099 therapists who are onboarding with these specific platforms by following certain verification requirements that result in the counselor being added to the platform in order to begin receiving referrals. Another way is through the counselor's own referral gaining efforts and conducted with an electronic health record system. I currently use Simple Practice, which is a one-stop shop with simple HIPAA compliant abilities, simple and effective HIPAA compliant abilities to communicate via email, chat, and video, as well as a scheduling option that includes collecting payment information from the client. Insurance can also be filed through a platform like Simple Practice. Other platforms listed here are a combination of referral-based, private pay by clients, insurance-based, and another platform where the counselor can list a bio page. The subscription services like BetterHelp and Talkspace will advertise and gain subscribers who pay a rate to be able to be then matched with counselors. Companies like Teladoc and MDLive will contract with insurance companies, onboard counselors by credentialing them basically with the insurance companies, and then list a bio from which the insured client may choose from a provider list. A company like TrueCircle offers a platform of synchronous and asynchronous communication with a client who has chosen the therapist from a list of bios or who has been invited to the platform by a counselor in private practice. These are a few examples, and there are many more platforms you can find out about with an internet search. We'll no doubt be seeing and learning about different platform business models as this online profession grows. I will now share about what I'm calling a typical flow of a turnkey platform available to counselors and as of the recording of this training. Not everything I do may be possible on all platforms. However, I feel like I can present these ideas in such a way that they may be useful on any type of platform that's been described in this training so far. When I receive a referral, I'll have access to and be reading some sort of assessment that's been gathered at the time the client has signed up for counseling. I currently look for a couple of things up front, such as, has the client attended counseling ever in the past? Is the client currently or has ever had suicidal ideations? And what the presenting symptoms are. It's my understanding that I'm being matched with clients who are seeking what I describe in my bio as my niche, specialty, etc., but I can scan the referral to assure that I feel like I can help that client. In the current platforms I'm utilizing, I feel confident that if I deny a referral, that the reasons I give are then used to continue to find that client a compatible therapist through the platform, or they are referred off of the platform and to local providers. If I'm not sure that that's happening, I would essentially take the case and make the effort to do that referring for the client. At this point in my current flow, I've not accepted the referral as I'm describing the flow to you at this point. Another thing I can scan for is suicidality. If I haven't already been assigned the client and still have the choice, if the client has been suicidal within the last year at any time, and especially if within the last 3 months, I will likely decline the referral, stating that I don't feel the client is suitable for online counseling due to current suicidality risks. And again, I trust that the platform is referring the client appropriately, or I would be doing it myself. Online counseling is not appropriate for every mental health issue. Serious mental health issues just aren't going to be helped effectively online. Okay? So if I feel like I can help the client and they're appropriate for online services, I'll accept the referral. In the platforms I work with at the time of this training, it is after this initial message that I send the client that they will read and sign my informed consent, which I have provided you an example of, or will be providing you an example of, that you should be able to download from this training. Currently, when they agree to the informed consent electronically, that is my record of the client signing my informed consent. Platforms like MDLive and Teladoc have the client agree to a pretty general informed consent regarding receiving counseling over electronic means. I provide further informed consent information unique to working with me to every client. It's during this initial time that I'll find out if the client is going to be willing to send the contact information I require, and I will usually find out if they don't want to engage in video sessions, etc. I then decide to send a general release of information form or then discuss it in the first session, if this is going to be necessary. I explained that they typically sign this document in any doctor's office. It's always a choice, and that if they do not, in the case of me needing to refer and discuss their safety or care with a third party, I would not be able to unless they provided permission. Usually the client cooperates at that time rather than waiting, and so far this works fine for me. I have invited the client to provide a picture of themselves holding their ID, or let them show it to me in the first video session. It's at this time that I may be explaining to the client the reasons I will want to be able to identify them and know their location, which adheres to my ethical obligation to do so. Most people understand, and if they don't, they quickly move on to change counselors within the platform or cancel altogether, and the issue resolves itself usually pretty quickly. The people who do want to do the work and can understand the reasons I'm asking for identifying information usually just go ahead and continue with a live appointment, start the process of sending identifying information, and we move on to begin counseling. When an appointment is booked, I typically send a script. Sometimes it's copy and paste if it's information that would be pertinent to every client. And I believe I'm going to be providing you an example that you can download from this training. It thanks the client for scheduling and provides information they may or may not have been notified of, outlining how we can connect using technology, what my cancellation policy is, and I also let them know more information about my theoretical approach. When we meet for our first live session, I always start out by informing them further about some housekeeping items related to limits of confidentiality, finishing up the intake process, assessment process, confirming the address from which we would be doing sessions, looking at their ID. It's advised to even establish a code word or phrase should we end up talking on the phone or chat window and I need to verify they're still who they say they are. I go over limits of technology issues and point out that extra caution is taken by both of us to ensure confidentiality, like protecting our devices and meeting in private areas, etc. I use this initial time to finish assessing for suicidality and respond to issues regarding previous counseling and what to expect from counseling in general in terms of length and planning for discharge. I spend a good portion of the first session hearing the client's story, of course, then we book the next session before we end. For clients on my platform who become silent and don't book appointments, I might decide to send a script every week, which I provide an example for you, and many times they'll start working. If not, they eventually end their subscription or change counselors, and the flow of intakes and discharges continues. I also will document a SOAP note concurrently within the session, and I'm able to save this within the platform that I use. As I mentioned, I have provided downloadable documents that include an introduction template, an informed consent tailored for online counseling, a release of information and suggested common repeatable scripts suitable for every online client. Here's what I say in the introduction. Thank you for sharing information about yourself. I'm so happy that you reached out for help. I'm Beverly Vanover, a licensed therapist. You can read more about my background, education, experience, and counseling approach located on this platform. For subscription-based services like BetterHelp, I will say this. At your earliest convenience, please provide the following information by typing it into this room to facilitate informed consent. I ask for full name and birth date, complete address and phone number from which you'll be attending live sessions, one valid emergency contact. I ask for a photo ID. I tell them they may upload a picture of this identification or show it on a video during the first live session. I let them know we'll be setting up live session using video chat or phone. Our first session will need to be video, and video is preferred. I let them know this up front. You'll see a link where you may schedule an appointment with me. I'm generally available Monday through Friday on the hour beginning at 9 a.m. ending at 5 p.m. Occasionally I offer some evening and Saturday morning appointments. If you don't see this schedule, please let me know your availability, as I might be able to set an appointment for us. In the meantime, please feel free to post this room or message or use the messaging feature if it's available as you feel led or have the need, providing you're able to. Okay. I will respond typically the same day within 24 hours to your initial posts. After establishing response time could be as much as 24 to 48 hours. I'll always be notified when you've posted. In the event you need to cancel a pre-booked live session for non-emergency or foreseeable reasons, please provide 24 to 48 hour or 24-hour notice. So this is written to them. And then at the beginning of the informed consent, I will also ask for the contact information if I need to. Because my informed consent reads like this. I understand that the service provided through an online platform is not intended for crisis situations and urgent needs. Although not typical, response time could be as much as 24 to 48 hours. In a crisis situation, I agree to call 911 or local emergency services or visit the nearest emergency room. Information shared with my counselor is confidential except in the following circumstances. And then I go over the basic tenets of informed consent, you know, such as everything's confidential except in the following cases of self-harm or reporting child abuse, elder abuse, these kinds of things. I also point out that if you've indicated a plan for suicide during your intake, your counselor will assess you for your safety and appropriateness for online counseling as a first priority. They're agreeing to this. My counselor will verify state of residence and access contact information in the event of emergency and for state licensing compliance reasons. And then it's important that I let them know clients need to be physically located in the states the counselor is licensed to provide services in. Many frequent scripts have to do with topics such as how to set up appointments, typical hours of operation, response time, policies regarding typed correspondence, cancellation policy, weekly check-in messages for radio silent clients that provide an invitation to work and/or instructions to change counselors or cancel subscriptions, instructions for completing and returning release of information forms, uploading pictures of an ID, thanking them for scheduling, and any technology information needed to proceed. I'll include some open-ended questions about previous counseling, what long-term changes would be desired, asking solution-focused questions, and recommending bibliotherapy or psychoeducation resources. To summarize this training you've received, we have addressed identifying standards of governing bodies such as NBCC, ACA, APA, NASW, and individual states regarding the provision of online counseling. And we've come to understand how we can ethically provide this service. We've identified the need for training to provide online counseling and learned that there are additional skills to develop which are also expected from us when we secure liability insurance for our profession. We've gone over some best practices utilizing the camera, phone, and written communication and the uniqueness of building rapport these ways versus in person. We've become aware of some online platforms that will onboard us as counselors and send us referrals or place our bios for clients to choose from based on our niches or expertise, and have explored the flow of referrals from at least one type of platform. You'll find examples of downloads of informed consent, release of information, initial and introductory messages, and common repeatable scripts of information that would be suitable for most clients engaging in online counseling or counseling in general. I hope you found this training useful, and if you have any questions or comments, please direct them to me, Beverly Vanover. You can reach me at dragonflycounselingandcoaching@gmail.com. And my website is www.dragonflycounselingcoaching.com. That's dragonflycounselingcoaching.com. No and in there. Thank you for your time and attention. Have a great day. And best wishes building your ethical online counseling practice.